members of ACK Church, men and women. They were interested to know about diabetes because they felt they needed to be well informed. Diabetes comes in under emerging diseases, although it is an old disease. And it falls, the emerging diseases for other communicable diseases and non-communicable diseases. Among the emerging communicable diseases is diseases such as SARS, COVID-19, and tuberculosis or TB. Among the non-communicable diseases is cancer, high blood pressure, diabetes, and also substance abuse such as alcohol. They fall under that category. However, this afternoon, we are going to handle one of the common problems, and that is diabetes. Diabetes mellitus is a common disease in our setting, as I mentioned earlier. And diabetes is defined as a chronic disease characterized by chronic elevation of the blood sugar level in the blood. So the blood sugar tends to go high. And when it goes high above the normal and expected, then a person is said to have diabetes. The normal expected blood sugar in the blood for you and me is 3.5 millimoles to 6.5 millimoles per liter. Continued, if a person has high blood sugar in their blood, there are problems that can occur, and especially if it is for a given period of time, for a long time. The blood level, the blood glucose level, which is above normal, causes damage to blood vessels. For example, the vessels of the blood. The other area they affect is the heart. They damage the heart. They damage nerves. They damage kidneys. They damage the eyes and the feet. So the sugar, the extra sugar, high level extra sugar, becomes like a poison, poisoning all those blood cells or tissues. Diabetes is a very common problem. It occurs actually worldwide. It occurs worldwide. In our setting in Kenya, it is a common problem. It is called the silent epidemic. When we were talking about COVID-19 sometimes back, we talked about epidemic and pandemic, because pandemic is when it was occurred generally in the whole world. Epidemic is a disease that occurs generally in the whole world. And in our setting here in Kenya, in towns, for every 100 people, about 11 have diabetes. In our rural setting, Hoko Shago, for every 3 people, there are about 100 people who have diabetes. Here in Nakuru, at level 5, there is an average of 600 patients per month, average. Children, that is among adults. For children with diabetes, 200 per month. And every week, you have about 5 to 6 new cases diagnosed with diabetes. So it is actually a common problem. How does a person know that they are getting diabetes? Those are the presenting symptoms. One is a thirst. Thirst was formerly used to detect a person with diabetes. They would come in and say, I keep feeling thirsty. However, these days people are drinking a lot of water, and therefore this has been masked a bit because of the fact that many people these days drink a lot of water. The other is waking up at night to go to pass urine. That is another sign. The other sign is, especially for the young people, the children, they tend to lose weight. They are eating, but the sugar is not being used. The carbohydrate is not being used in the body, so they tend to lose weight. The other is feeling tired. They took carbohydrate food to get energy for their body, but since the body is not using it, then they feel tired. However, it is good to note that even diseases like anemia can cause a person to be tired. The other is that when a person has diabetes, they also have to general ill health. They are generally unwell. They don't enjoy very good health. The other is that sometimes their eyes are affected and they are not being able to see very well. In fact, some people are detected or diagnosed to have diabetes because they have gone to see their eye specialist, and the eye specialist finds that they have a problem and tells them, you go first, have your blood sugar checked. The other is muscle cramps. Also, people with diabetes tend to be more prone to infections. So they tend to pick infections on and off. So they don't generally enjoy very good health. Diabetes can be diagnosed. One of the key areas of checking whether a person has diabetes is taking a sample of blood and testing for blood sugar. And this is done, this special test is called glucose tolerance test. And it requires a person to fast for a period of 6 hours before you do the test. Then this can be able to be used to test and to confirm whether a person has diabetes. What causes diabetes? Diabetes is caused by many factors. They say multiple factors. It's not like COVID where you say the virus. This is different. One of the factors is there is an organ called pancreas. Pancreas is near the stomach in our abdomen. That organ produces a chemical which helps a person to use, to be able to use the sugar and the energy foods that they took to change it for the body to use. It produces that chemical. The chemical is called insulin. If it has been affected by a disease, or if it has a growth, then the pancreas does not do its work very well. So a person can therefore develop diabetes. The other is maybe the part in the body, the cells in the body that are supposed to make the insulin, which helps to use glucose and carbohydrates in the body, is not producing enough. Maybe it has some defect. Therefore, again, that can contribute to diabetes. The other is the beta cells. They are beta cells of the pancreas, which specifically produce the insulin, may themselves be damaged by disease and therefore are not working well enough to produce enough insulin for the body to use. The other may be genetic. Family. The family may have a problem and therefore it is passed on in the genes and therefore one may have diabetes. When a person gets diabetes, there are some factors that are associated with diabetes. One of them is sedentary life, a job where you sit and you're not up and down. No wonder then in our towns where we have people who sit, as opposed to the rural setting where people go to shamba, you may have more cases because of the sedentary life. The other is diet. Highly refined foods. For example, foods cooked with unga number 1 ugali, unga number 1, the white flour for chapatis, sugary foods, ice cream, and those kind of things, and cakes. Those ones contribute or are associated as a risk factor for diabetes. Early childhood malnutrition. If a child has had malnutrition when he's early in his life, this may result in beta cells which produce insulin being damaged, and therefore as an adult the child can end up with diabetes. The other aspect is obesity, people who are big. When people have high body weight and high body fat, these interfere with the use of insulin and may therefore contribute to a person developing diabetes. That is why it is also associated with development of diabetes. The other is worry. Some people tend to worry. You and me cannot stop worrying on our day-to-day life. There are very many issues. But when we carry that burden daily and it becomes a stress for us, then diabetes is likely to set in. Diabetes, although it is common and develops amongst us, it is good to know that it is possible for it to be treated. For a person who has diabetes, it can be treated. Usually, diabetes is treated by giving medicines The medicines given are meant to reduce the level of blood sugar in the blood so that it comes to a normal level. It can be either medicines taken by mouth or it can be in form of injection. I came with some medicines. I have some sample. This is one of the medicines used. It is called glucophage. It can be used to treat diabetes, and it is taken by mouth. The other is probably by injection. I also have something with me that can be used to give injection, because the person has to take the medicine at home or give himself or herself injection while at home. And that is why it is important for you and me to note that herbal medicine. We have people, I respect them, who provide herbal medicine, but herbal medicine may not be useful for treating a disease like diabetes. The other area of management is food, diet. Diet becomes very important as part of treating diabetes. The person who has diabetes should not have sugar at all. Whatever they eat or drink should have no sugar. The other is that we tend to recommend that they take traditional foods. Most of our traditional foods have high fiber and low fat. For example, ugali, mokimo, githeri. Those are traditional foods which are high in fiber and low in fat. Also, foods such as sweet potatoes and arrowroots. The other aspect of treatment is reducing the amount of food. Large amounts of food may not be very good for somebody who has diabetes, and they are usually advised to take small amounts of food. They should not miss meals, but they take small amounts so that the food the person takes is used up in the body. So preferably, therefore, when serving, use a flat plate where you can be able to put food, as opposed to the plate that looks like a bowl where you can put a lot of food without realizing. The other thing to consider is avoid extra helping. The food may be nice and sweet, but avoid a second helping. The foods which I usually tend to be recommended, as I've mentioned earlier, are foods such as porridge from wimbi, oatmeal, wholemeal bread, brown rice, wholemeal chapati, unga number 2 as opposed to unga number 1, which is highly refined, sweet potatoes, and arrowroots. Those are high fiber foods which are more beneficial. I think the other thing to remember is also in the market there are also high fiber cereals such as Weetabix and many others that one may be able to pick which they can use. The other aspect of management is physical exercise. Physical exercise, for example, regular exercise, walking, minimum half an hour in a day. Not walking very slowly, but walking a bit faster. That helps to use up some of the carbohydrate in the body. The other aspect of exercise which is good is that when one moves about, it helps to improve blood circulation in the body, and that is also helping to improve the quality of life. Their weights can be used. If a person is not able to walk and probably they are busy in the office, they can also use weights which help to walk a bit, and even if you don't walk a bit, they help. The weights. This is 1 kilo. They can be tied at the ankle, and they also help. For somebody who may not be able to walk, they can be used to help, just as if the person is walking. The other is weight lifting. Again, the weight for both arms. They are also good because they help to use up the energy. 1 kilo again, the person would start with 1 kilo and not heavy. At least once a day, that would help. There are people also who go out and they want to spend time. Instead of probably staying in the house, a time when you wanted to spend in prayer, it is possible to take a walk and pray during the walk. That also helps to be able to do 2 things at the same time. The key issue also comes in form of avoiding injury. Key issue in avoiding injury, especially in the feet, on the feet and on the legs. Even a very small cut on the feet or at the toe may become a very big wound, difficult to heal for somebody who has diabetes. So a person with diabetes is advised under no circumstances to avoid a cut. We shall talk a little more about that a little later. The other aspect of managing diabetes when a person has diabetes is education. Education is important for that person who is sick to avoid, to be able to know about the disease so that they can be able to know how to cope or how to manage themselves when they have diabetes. And the education is not just to the patient alone, but also to a sibling, a daughter, a son, the wife, or somebody else important who is living with that person who has diabetes. One of the aspects of education is the self-care. How do you manage to take, for example, the regular meals? A diabetic person should not miss meals because the medicine taken, either in form of mouth or injection, should match with the drugs the person is taking. So the person will eat regular meals, for example, after breakfast, take a snack, lunch, take a snack, and then supper. 4 to 5 snacks, 3 snacks and 3 meals in a given day, but small amounts so that they match with the medicines taken. The other is the importance of regular exercise. The exercise is when the medicine was given, the doctor considered that the person will do exercise. And that is why I mentioned earlier about the importance of half an hour of walk per day to cater for the exercise. The other is how to take the medicines. When a person has diabetes, they need to know how to take the medicine. When a person is taking medicine for a long time, it is possible for them sometimes to think, did I take medicine or have I forgotten to take? And therefore, the best approach when one is taking medicine, use a medicine cup. Never remove medicine. Excuse me. Never remove medicine from where it is and put direct. Always remove medicine, put in a cup. Remove medicine properly and put in a cup. Don't take it where you have removed it. Preferably, go to where you have your food and take it with the food. That helps you to remember that whenever I'm taking breakfast, part of the breakfast, I have my medicine and then take. When you see the empty cup, then you know you have taken. When the medicine cup is not empty, then you know, oh, I had forgotten. Then you can take. That helps. Otherwise, it can be a disadvantage. The same for the injection. Take it at a particular time of the day, mostly in the morning, but associate it with a meal so that you do not forget, because an overdose can occur when you think you have forgotten, or you can miss to take the dose and think you took. The other point to remember is that insulin is usually kept in the fridge. So the person with diabetes, you need a fridge to always keep the medicine in the fridge. If it is not put in the fridge, it gets damaged. The other aspect is to monitor blood sugar. A person who has diabetes needs to know what is the level of my blood sugar today, and at least once a day. The small finger, the small finger, especially on the side, is an easy part to take blood sample. Just a click, and then you remove a drop, and you can be able to test. There is a tool for checking at home, and it is good again to note that the small finger is less painful than the middle finger, which is most painful. So avoid the other fingers, use the small finger for checking the blood sugar. The other thing to remember is when a person has been diagnosed to have diabetes, they need to always see their doctor. They should not miss an appointment. Always make sure that you follow up to see the doctor so that the doctor can see how a person is progressing. Of course, once you have been seeing the doctor regularly, you may find that in some cases you may even have 3 months appointment because you are now coping and you don't need to see the doctor very often. The other issue to remember is the care of the legs. Care of the legs is key in management of diabetes. It is also part of promoting the health of a person who has diabetes. I mentioned earlier the importance of walking. So it is very important for the person to be walking to improve blood circulation. and to be very careful not to have any injury on the feet or a small scratch, because as I mentioned earlier, a small scratch may end up with a very serious wound, because a person with diabetes, they tend to take a little longer to heal than other people. I think the other issue to remember is, therefore, not only does the patient take his feet, the other person at home who has been educated needs to at least every day check on the feet. Is there a scratch? If there is a scratch of injury, it needs to be treated. One of the items that can be used to treat is to use a little salty water, clean up, and then that will help. And sometimes also natural honey can be used on that wound to help to heal quickly or faster. A person with diabetic needs to remember never to wear tight-fitting shoes. It is very important for a person with diabetes to always wear well-fitting shoes. That will help to avoid the soles that can occur in the feet because of walking or wearing shoes which are not well-fitting. The other issue to remember is that if a person is wearing socks, there are some socks that tend to be tight. That also should be avoided because they interfere with the circulation. The socks also should be well-fitting. That helps to avoid the damage or scratches in the feet. Diabetes can be prevented. It is possible to prevent. You and me can avoid diabetes. How do you avoid diabetes? One of the aspects is avoid extra weight. Avoid extra weight. There is something called body mass index. Body mass index is an index of weight for height. It is used to classify overweight and obesity in adults. It is possible for you and me to calculate the body mass index by calculating weight in kilograms, and then you divide by height in meters square. And then whatever you get, that is what is your body mass index. There is a range which is used to be able to classify you, for you and me to classify ourselves, whether we are having normal weight, whether you have overweight, or whether you have obesity, because obesity and overweight are key contributors to diabetes. The range is 16 to 18.4. That is, a person is considered to be a little below the expected weight. 18.5 to 24.9 is supposed to be or expected to be the normal weight range. When a person has 25.0 to 30.0, that person is overweight. And when it goes beyond 30, then the category is for obesity. Overweight and obesity should be avoided. You and me should avoid them to avoid diabetes. So the issue of reducing weight is key. Again, reducing weight, for those who have attempted to reduce weight, it is a task which is an uphill task. It is a difficult task. Putting on weight is very easy. It's like blowing up a balloon. But reducing, it's an uphill task. How can you and me reduce weight? One of the things to remember is, for you to reduce weight, the key factor is food. We talked earlier about food, reducing the amount, avoiding second helping, and avoiding highly refined food and taking high fiber foods. If you, by God's grace, you are able to reduce that, then you can be able to reduce weight. The other is exercise. One of the advantages of exercise is to promote blood circulation, and that improves the quality of life. You and me, again, can learn to do exercise, especially those of us who are in town and do work where we sit. If you walk a bit, half an hour per day, minimum 5 days in a week, that will help to keep your weight down, to keep your body fit, and that is a way of reducing chances of diabetes. The other is regular medical checkup. Although you and me are not sick, it's good for you and me occasionally to visit a doctor's clinic. If you are taking somebody into a hospital for other issues, it is good for you to have a checkup. Even if you're not having the complicated checkup, just the weight, checking the weight or checking the blood pressure. Those are good measures that one can take so that you can be able to check how your body is going. The other is, in case then a person has been diagnosed to have diabetes, then it is good for the person to remember how diabetes is managed and to keep to the instructions given by the doctor so that they continue to maintain a good weight and to continue to maintain diabetes at a normal level so that it does not go out of hand and therefore enjoy better quality of health. Diabetes has complications. A person with diabetes can have complications. If it is left out of hand, it has complications. One of the complications of diabetes is, for example, I mentioned earlier about care on how to take medicine. If a person takes medicine, an extra dose, and forgets to eat, or does not eat as required, then they can have a condition called hypoglycemia. That is when the blood sugar is too low to cope with life. A person may become irritable, confused, the skin become moist, and then they can go into coma. That can occur within a short period of time. For example, let me use, if they are taking injection, that can be very fast. But if they are not taking injection, probably within a period of 12 to 24 hours, but it can occur. That is a complication. The other is, if a person is not taking medicine, is not aware they have diabetes, then sugar builds up in the body. That is what is called diabetic ketoacidosis. Sugar builds up in the body and becomes poison to the person. Again, the person may become drowsy and ends up in a coma. So those are two extremes of complications of diabetes. The other is that there is eye damage. The retina of the eye is damaged and one has a problem with vision. Some people develop cataract early because of diabetes. The other is infection, and the person does not recover as fast as expected. The recovery from infection is a little slower for people with diabetes than other people. The other complication of diabetes are diseases associated with blood vessels. We mentioned earlier that the sugar in the blood damages blood vessels. So the person may develop high blood pressure or heart disease because of that little sugar, extra sugar in the blood, which is circulating. And that therefore contributes to high blood pressure and heart disease. The other complication is damage to the nerves. Again, we mentioned at the beginning that sugar in the blood, when it is a higher level than expected, it damages nerves. So a person may have a problem with nerves, and some of the areas especially affected are the feet and the legs, where the person is not as sensitive as possible. Therefore, they can walk on a knife and they don't realize their leg is cut and they just continue to walk. They may sit near a fire and they do not realize that the fire is too hot and they continue to sit there and they get burns. That is how a person with diabetes may therefore develop injuries on the feet without realizing, and they can go on and become big sores because they didn't realize that they were having injury. And those injuries of the feet may end up, especially when they go out of hand, the person may end up with amputation of either of the toe or of the leg because of a wound which does not heal and is causing a big problem. So that is about diabetes. Today we have learned about it. In the coming days, maybe we shall learn a little more about other conditions. The forum is open. You may ask questions if you have any. You're welcome. You can also make a comment for discussion. Otherwise, my name is Jacqueline Mugo, Mrs. I have PhD. I'm a PhD student in community health, and I'm happy to have spent this afternoon talking about one of the issues that is affecting our people, and that is